So did you know that in the U.S., about 44 million people suffer from migraines? Some migraine studies estimate that 15% of adults in the U.S. population have a migraine. And there's 2 to 3. I think there's anywhere from 2 to 3 million migraine sufferers that are chronic. So it's a serious problem. 91% of people that have migraines miss work or can't function normally during a migraine attack. 70% have a family history of migraine, and 70% of all migraine sufferers are women, but those numbers are changing very rapidly. I'm learning all this from my good friend. His name is Russ Mitchell. Russ Mitchell is the CEO of Puramed BioScience. Puramed BioScience stock symbol is PMBS, in their website, Puramed BioScience singular, PuramedBioscience.com. Of course, you probably heard of the ever popular cold drug that you see at your drugstore called Coldies. He was the guy behind Coldies. Huh. He's with us today, and he's got himself another solid product. Russ, how are my numbers on that? Do I have my numbers accurate on the migraine sufferers, pal?
Well, actually, Sully, you're a little light. First of all, it's great to be back. But
Second of all, no one's ever said, Sully, you're a little light. So let me just say that you are getting a very big Christmas present this year. I don't care how fit I am and how many miles I can ride on a bike. Nobody will ever say, Sully, you're a little light. So God bless you. Anyway, so the numbers are greater than that, though, aren't they?
Oh, there are, because recent studies have shown that sinus headaches, 9 out of 10 times sinus headaches are actually migraine headaches as well.
Oh, so now you got to lump the sinus headaches in with the migraines, and that almost doubles that number, doesn't it?
It makes it much, much larger. Yeah, you're right. It's about double.
Talk to us. I want to get right into this because every time I have you on the air, I get a lot of people emailing me about exactly what the product is, and they want to know. First of all, you can buy your product right at the drugstores now. So tell us about the product and where can you find it. Let's get that out of the way right away.
Great, thanks. The product is called LipiGesic M. It's actually a gel that's been developed to apply under the tongue, so it works very fast. It uses something called sublingual drug delivery. And based on the science done by world-class headache experts, it's now shown to be an excellent performer, a highly effective first-line therapy, and it actually outperforms the #1 selling prescription treatments. So it's a big breakthrough in the treatment of migraine headaches, and you can buy it now nationwide at both Walgreens pharmacies and CVS pharmacies. You can also look at knockoutmigraine.com, and you can find out additional sources as well.
Knockoutmigraine.com, of course, is the website. You can also order online there. But here's my question for you. You know, this is not a new problem, Russ. Migraines are not a new problem, and especially, and I love the fact that we talk to our armed forces audience here because there is a specific PTSD migraine study that's going around as well. But this is nothing new. There's plenty of drugs that are prescribed by doctors, but it seems to me that everybody's chasing a rabbit. No one's really found a cure here. Is there going to be a cure at some point? Could this possibly be the cure, Russ?
Well, migraines are a very difficult to treat. It's a complicated disease. They've been trying for years, and they've come out with a line of products called Triptans that were designed to help treat migraines. And a recent study came out that even though there are a number of Triptans out there, by switching back and forth between the various forms, they're not getting any gain. In fact, some people are losing efficacy by trying different meds. So it's a very tough treatment, but we've come up with a great new way to treat migraines in the sense that now we have something that's not only more efficacious than the current treatments, but it's also much safer. It has a much reduced side effect profile. It's much easier to get because you don't need a prescription, and it doesn't have a lot of the drug interactions associated with a lot of the prescription drugs. So it actually outperforms in every measuring point what the current prescription drugs offer. It's a big advancement.
The interesting thing that you just said, though, that it's a disease. It's a disease. I never thought of it as a disease. Headaches are headaches, aren't they?
It is a disease. In fact, it's one of the most debilitating diseases on the planet. It's ranked as one of the most debilitating diseases by the World Health Organization in the sense that people are considered to be as affected as if they were quadriplegics. They can't function.
So it just knocks them out, doesn't it?
Yeah, it really does. The name of the company, by the way, Puramed BioScience. PMBS, Peter, Mark, Bravo, Sam. PMBS is the stock symbol, and then PuramedBioscience.com is the website. Russ Mitchell, the CEO, our guest today. Of course, you can buy at Walgreens, CVS, and is it called knockoutmigraine.com? Do I have that website right?
That's correct, Sully.
And then, of course, LipiGesic M is the name of the I'm gonna call it homeopathic drug because that's what it is. But let's talk about that, because one of the best things I read recently was that patients that are switching between current prescriptions. This goes to my last comment. When someone's going from Cafrago or someone's going from one drug to the next, patients are seeing very little difference in their efficacy. Not so much with you folks. You guys are getting better. You're outperforming leading prescribed drugs, are you not?
There's no question about that, and that's not just our opinion. That's the opinion of leading experts in the field. We actually have shown not only clinical evidence, but additional scientific analysis that shows us to be more effective than the leading prescription drugs without the side effects, and we're also showing a high consistency. Oftentimes what happens is that people taking current prescription drugs sometimes get relief, but for those people that get relief from LipiGesic M, there's a very high consistency level, so it works virtually all the time for them. So they can no longer have to worry about avoiding various social functions and things like that, because they know they're going to get a migraine, because they know that as long as they have their LipiGesic M, they'll be able to handle it very quickly and just move on and function normally.
Again, the name of the product, LipiGesic M, the name of the company, Puramed BioScience, PMBS is the stock symbol. Russ Mitchell is our guest today. Russ, I have to ask, with respect to the Coldies success, what the exit strategy on that versus the exit strategy on this? Coldies is not a public company, were they?
Actually, it was a public company.
So it was a public company. So why not keep some of these patents in your own name, and kind of bundle them up and sell them to a bigger company? Are you worried about getting diluted, not with respect to stock, but with respect to technology? Or continue.
The technologies are patented, and we are continuing to build our patent portfolio. Of course, there's always situations where people, would potentially look at us as an acquisition of sorts. We've always built the company to operate on our own, but you never know. Obviously, as more people become aware of how effective LipiGesic really is and what a breakthrough it's become, you never really know.
Yeah, tell you what I want to do. I'm going to hold you over. I know you're busy, and I told you I wasn't going to keep you long. I'm going to keep you long anyway because the topic's too interesting, and he's too good of an interview. Russ Mitchell is the CEO of Puramed BioScience. I want to talk to him about the Armed Forces Radio listeners, because there's a lot of PTSD sort of things going on with respect to migraines, and with respect to that, Russ has an answer. Russ Mitchell, Puramed BioScience, PMBS is the stock symbol. More Big Biz Show after the break. Good stuff. Good to have you along. Russ Mitchell, the CEO of Puramed BioScience, is with us to talk about migraines. Russ, tell me what the problem is with our Armed Forces Radio audience with respect to the migraine issue. I just read a recent report about a PTSD and migraine link. Is that accurate?
That's very accurate, unfortunately. Actually, migraines are common among U.S. military personnel in combat zones. Roughly 37% of those people in Iraq that were deployed were actually suffering from migraine headaches.
So there's a cause and effect issue. I mean, could stress be the issue, or is it more genetic than that? Because I got to believe that if something like combat starts migraines, then it could be a situational sort of disease.
It is in many instances, and they're just discovering a lot of that now. Even though migraines are a genetic disease, what happens is when they go overseas and deployed in a combat area, it could be the heat, it could be the stress, different eating and sleeping patterns, and of course there's always the blast exposure.
Oh, of course.
Yeah,
and that's a big problem.
Yeah, the issue. I think we need to do a study on how much, on broadcast personnel versus military personnel, because I hardly ever get migraines. But the people that work for me, Chris Janicus, for one, always complains of migraines. Russ, thank you so much, brother. I can't wait to see you in studio. As our resident expert. In fact, we're going to do a special broadcast with with Russ for the American Forces Network, a full half hour to talk about this problem. They're going to air that as a special coming over for this. So we're going to tape that this week, and then it'll air starting next week for quite a while. But yeah, good stuff. Of course, Puramed BioScience is their website, Puramed BioScience, and then they are publicly traded. PMBS is their stock symbol. So there you go.